Hey everyone, okay, so today we're going to be talking about contact therapy for breakouts and acne-ish. Now, contact therapy is brilliant. However, if you have a really good amount of breakouts or acne, contact therapy probably isn't the best bet for you because you're going to need a stronger approach. Now, I dealt with acne when I was about 20 years old, incredibly depressing period of my life. And I've done a video on it, so I'll link it here and you can click on it. And it shows you how to deal with acne very, very fast. There are side effects to it, but to me, they were minuscule compared to dealing with the acne. Okay, so contact therapy is where you apply a product to the skin that is generally irritating, and rather than leave it on, you apply it for a short period of time and rinse it off. The products we're going to be talking about today are benzoyl peroxide. Now in the UK, benzoyl peroxide is much harder to find than it used to be. You used to be able to get it over the counter at 2.5%. You can't now. You have to get it over the pharmacy. Now there are a few brands, but the one I like is Acne, which looks like this. Now this is actually the face wash and this is the treatment. Both contain the same 5% benzoyl peroxide. You can get 10% benzoyl peroxide, but the difference in 5 to 10 is very minimal on the effects it has on the skin. So get 5, it's less irritating and you will see the same results. In the US, you can get much, much larger versions for the same price, pretty much as this. And they look like this. This is the one by acne.org and it is huge. So if you want to get that and you're in the US, great. So a couple of days ago, I applied something to my skin and it caused a breakout on my skin. So I'll be using contact therapy to deal with it. So here's what you do. You get your product. Now I'm going to use the face wash, the Acne face wash. Acne do a load of products for acne. Avoid pretty much everything apart from these. They contain fragrance and they stink. Okay, so what you want to do is get your benzoyl peroxide and apply it to the area that is affected. Rub it into the skin on all areas where there are breakouts. And I'll talk to you about preventing breakouts in a second. Then all you do is leave that on the skin. Leave it on there for 5 minutes, 10 minutes, 20 minutes, then just rinse it off. For those of you who are breakout prone but have generally clear skin and want to maintain that, you can do contact therapy over your entire face 2 or 3 times a week and it will keep it at bay. Benzoyl peroxide is the most effective treatment when it comes to breakouts. It really is. And that is contact therapy. It's very, very, very simple. I'm 44 and I still have some troubles with breakouts and it is a pain, and I'm now going back to contact therapy and I'll be using it probably 2 or 3 times a week all over my face, and I'll just use the face wash because the face wash contains 50 mils of product for basically £10. The gel is about £10 and contains 15 mils. So I know which one I'm going to be using. With contact therapy, the side effects are minimal, very, very minimal, but you can still get them, which is dryness of the skin and redness of the skin. It's not a big issue, you can deal with it. But generally speaking, if you're only doing it a couple of times a week, there should be 0 side effects. And this routine really is for those of you with minimal breakouts and or those who are prone to breakouts who are just looking to maintain healthy, clear skin. There are certainly things on the market. Azelaic acid works great. Of course, there is tretinoin, all those kind of things, and they do work great, but they don't give the instant results that benzoyl peroxide do. And again, check out that video I mentioned on acne because you can use benzoyl peroxide on most forms of acne and get a really, really good amount of clearance within a week if you use it correctly. You'll be using a lot of it and your skin is going to get very red, very irritated and very dry, but it's absolutely worth it. Thanks for watching. Let me know what your thoughts are in the comment section below. I'll see you soon. Bye-bye.